Dear students, I welcome you to the series of my video lectures. This is my first video lecture and I am going to start from the very basic topic, that is anatomy. Now, what is anatomy or human anatomy? Anatomy is basically a subject in which we study structure of different organs and parts of the human body. For example, we study the structure of heart, liver, lungs, kidneys. So once we are studying the structure of any organ or any part of the body, we call it anatomy. So anatomy deals with the study of structure of different organs and different parts of the human body, which includes shape or appearance, number 2, size and weight, number 3, location or position, number 4, composition, number 5, relationship, number 6, blood supply, lymphatic drainage and nerve supply. Now, the explanation of these terms. First one is shape. In shape, we study about the appearance of an organ or a body part, or how an organ or a body part looks like. For example, heart. Heart is conical in shape or appearance, or we can say heart looks like a cone. Next is size. In size, we study about the dimensions like the length, width and thickness. For example, heart is approximately 12 cm in length, 8 to 9 cm in width and 6 cm in thickness. Next one is the weight, in which we study how much heavier an organ or a body part is. For example, female heart is approximately 250 to 300 grams and male heart is approximately 300 to 350 grams. Location. In our body, there is a particular place for every organ. In location, we study about the position or a proper place where an organ is located in our body. For example, heart is located in the thoracic cavity, between the lungs, in the space known as mediastinum. More specifically, it is located in the middle mediastinum. Diagrams are very important because they help us to understand better our concepts. In the diagram, we can easily identify the heart, or we can easily locate the position of the heart. Also, I have encircled the position of the heart. These diagrams or images, they are from the Netter's Atlas of Anatomy. It is a wonderful book. Next term is composition. In composition, we study about the constituents. For example, heart. Heart is composed of 3 distinct layers or 3 different layers like the epicardium, myocardium and endocardium. Some organs or parts of the body are present on the right side of the heart, while others are present on the left side of the heart, above the heart, below the heart, in front of the heart and behind the heart. All this comes under relationship. For example, on the right side of the heart, the right lung is present, and on the left side of the heart, the left lung is present. So, on the lateral sides of the heart, we have right lung and the left lung. And above the heart or superior to the heart is the bifurcation of the pulmonary trunk, or where the pulmonary trunk divides. Below the heart or inferior to the heart is the diaphragm. We can easily identify these structures on the diagram as well. And for the purpose of easy identification, I have marked the right lung with number 1 or digit 1, left lung with 2, pulmonary trunk with 3 and diaphragm with 4. In front of the heart or anterior to the heart is the body of the sternum. Behind the heart or posterior to the heart is the esophagus. And we can easily identify it on the diagram with the help of digit 5 and digit 6. So, in relationship, we study the parts or the organs of the body which are present on the right lateral side of that particular organ, left lateral, anterior, posterior, superior, and inferior. In the blood supply, we study arterial supply and venous drainage. Basically, in blood supply, we study the origin and course of artery and vein. Or in other words, we study the artery and vein right from their origin till end. In the arterial supply, we study the origin and course of artery. Artery is a blood supply, is a blood vessel which carries the blood from the heart to the different organs, tissues, or parts of the body. For example, we have right and left coronary arteries. These two arteries supply the blood to the heart wall. For example, right coronary artery arises from the anterior aortic sinus. Similarly, we have coronary signs, anterior cardiac veins, venae cordis minimi, or the smallest cardiac veins. These veins drain out the blood from the heart wall. So, in venous drainage, we study the origin and course of veins draining out the blood. Next, we have lymphatic drainage. In lymphatic drainage, we study about the lymph nodes through which the lymph drains out. Last example, we have sympathetic and parasympathetic fibers supplying the heart muscle or supplying the heart. So, sympathetic and parasympathetic nerve fibers supply the heart muscle. These are branches of the autonomic nervous system. Autonomic nervous system itself is a branch of peripheral nervous system. Once we talk about the innervation, it comes under nerve supply. So we have completed our first question, what is anatomy? Now second question, origin of word anatomy. Anatomy comes from a Greek word anatome, in which ana means apart and tome means to cut. So we can say that anatomy means to cut apart. This name was given because initially anatomy was studied by dissection, by cadaveric dissection, or we can say preserved dead bodies. Another name of cadaver we can say is preserved dead bodies. Now, what is dissection? Dissection is a technique of carefully cutting apart body structures. So we can say anatomy was first studied by carefully cutting apart body structures of cadaver. Okay. But nowadays, the scope of studying anatomy has changed a lot. I am not saying that nowadays we don't use cadaver to study anatomy. We still use, but nowadays there are other techniques available as well to study the anatomy, such as we have imaging procedures like magnetic resonance imaging, computed tomography scans we have, even we have ultrasonography. For example, for studying the anatomy of the heart or cardiac structure, we can go for echocardiography. So in the next lecture will be about the branches or subdivisions of the anatomy. Thank you so much.